Hi, welcome back to Ahead of the Curve. I'm your host, Dr. Megan Teed, and today I'm talking about the 3 tips for getting the most out of body work with scoliosis. This has come up actually quite a few times in the past few weeks with my clients because I work with the majority. It's changing a little bit with having opened the Wellco, but I mostly work with people online. So I give you the tools and tips for doing some self treatment, self myofascial release. But sometimes it's nice to offload that work onto somebody else and get some hands on treatment. So um, I've been giving them advice as far as what I recommend and also hearing what they do when they go and see somebody to get body work done, whether that's a massage, whether that's craniosacral therapy, something like that. So to I love to get massages. I love to get craniosacral therapy. Um, I'm very particular about who touches my body because people tend to see that rib prominence and they like to go to town on it when I go to get a massage. And frankly, that's not very comfortable. It is not enjoyable. And the person that's working on me tends to have no idea that how uncomfortable it is. They see it and they think it's a big muscle. Little do they know there's actually like a big bone underneath of there that they're working on. So it's not super enjoyable to have that be the focus of the treatment. So um, take these tips, take some notes for your next bodywork session. And when I say body work, I'm talking about any hands on therapy that helps improve how your tissues, your fascia, and nervous system move and communicate. Things like massage, craniosacral therapy, myofascial release, even acupuncture or visceral manipulation. Not all body work is created equal for people with scoliosis, and having that understanding um, and understanding your body, it helps you get the most benefit from the body work when you get it done. So, my tip number one is bring your wedges with you. So, I I know that it can't be. It's not the most enjoyable thing to tote your luggage, tote your wedges around with you. But having your wedges actually helps your massage therapist see your body in more of a balanced way. So, like I was talking about a little bit earlier, if you're just laying flat on the table without any props underneath of you, it's going to enhance and emphasize your rotations and your curve. So, if you have your wedges with you, so scoliosis wedges, I recommend um, the brand Happy Sew. I love them because they are made of vinyl, so they're easy to clean off. And you want something that's probably easy to clean off after you get a massage because you have the oil or lotion or whatever all over your body, and then it'll get on your wedges. So, recommend those. And when you lay on your back, you wedge a little bit differently than if you're laying on your stomach. And let me pause for one moment. Okay, so when you wedge on your back, you're going to wedge at your prominences. If you have the most common curve type, That would be a right thoracic and a left lumbar curve. These are what the wedges look like. And when you prop, you put the narrow end in first, and then the wide end sticks out the side a little bit. So you prop, and it'll look kind of like this, if you can see behind my microphone there. So it just has that wide portion poking out the edge a little bit. And um, a good go to remember how to prop would be prop what is dropped. And then if you're laying on your stomach, you're going to prop the opposite of that. So instead of having the narrow end go in first, you're going to put the wide end in first. Okay. And if you're laying on your stomach and you have the most common curve type, you're going to prop at the front of your left ribs and then the front of your right hip. Okay. As a reminder, I should say this more often. Um, this is not medical advice. This is just educational purposes. Um, so if you have any questions, always check with your doctor because I am not a medical doctor. I am not your doctor. Um, sorry to interrupt my thought there, but I just wanted to clarify that. So when you're propping in that way, when you're propping, especially for when you're laying on your stomach, and you're propping what is dropped forward, you are helping to yourself to derotate so that your back looks more even to your therapist. And that way, they're treating both sides of your spine equally when they're giving you your massage. The other reason why this is helpful is when they go and they're pressing in and they're working on your hollow side or your concave side, they're not pressing that concavity further into the concavity because you have that wedge or that prop underneath. It really helps you to feel more comfortable even when you're getting your massage. Um, My second tip is make sure that you're setting your expectations very clearly. When when you see this therapist, if you've never worked with them before, make sure that they understand that they're not there to straighten your spine. Okay? Most body workers are incredible at what they do, but they might not specialize in scoliosis. Here's like kind of an example of maybe something you could say to your therapist when you're first working with them. Say, I have scoliosis and I'm not looking for you to straighten my spine. I'm just looking for you to help release tension and balance out what is tight or restricted. You can explain to them what might go wrong if somebody is trying to push or straighten your curve. um, what happens is you can get more guarding happening in your body and you can actually increase the tension in your body. So it can have a completely counterproductive effect if your therapist is doing that. And it's similar to what I've explained happens if you're doing dead hangs or maybe even getting chiropractic adjustments, um, doing like really extreme stretching or traction, inversion tables, you get a rebound effect that happens in your body. So um, that's that's something that you should maybe try to educate them on very politely. Um, and the other thing is, setting that expectation, telling them to work on both sides of your spine equally. Um, and maybe even paying a little bit more attention to your collapsed areas because those are technically your more tight or your more restricted areas. And that will help to balance things out. So we're looking for harmony in your body, not symmetry. And then my third tip is to go the most gentle route possible with your body work. So, gentle work is actually often the most effective for scoliosis. And this is why I often start my patients or collective members in a supportive rest position, working on balancing out the nervous system, calming it down, in order to get the best effect from the work that we do in the future. And as far as body work goes with scoliosis, craniosacral work is super, super effective. Visceral or neural manipulation, finding somebody who is certified in the LTAP by Movement Rev. Um, LTAP stands for Locator Test Assessment Protocol. Basically, all of those therapies that I just listed, they are therapies that listen to where the body needs treatment first or needs attention first. And that this is great for any person with a body, but especially if you have scoliosis, because scoliosis is something that's visible from the outside. And there's a couple of things that happen when you go to see a provider and you come with a diagnosis. It's one thing, if you are coming just with a diagnosis that isn't visible. But if you're coming with a diagnosis that's visible, that is actually, something that people see as, and it's called a deformity still. I can't believe that. It frustrates me that that is still the case, that scoliosis is called a spinal deformity. That's a topic for another day. But um, it's really hard for the provider to overcome that in general, because they hear that diagnosis, they see that diagnosis, and they have this preconceived notion of what you need. So they no longer are listening to your body or assessing what your body needs. They're doing what they think is best, based off of the diagnosis and based off of what they see. So the more aggressive techniques like deep tissue massage, um, Swedish massages, Thai massages, that deep pressure, it can trigger a protective tension in your body. So less is more with scoliosis. When your nervous system actually feels safe, your fascia and your muscles, they will relax and they'll release, and that's when the magic happens. So the visceral massage, or sorry, I just am saying this wrong. The visceral manipulation, I'm actually trained in this, and I was trained through the Barral Institute, and that was created by a man named Jean-Pierre Barral. And he is fantastically intelligent beyond anything that I can imagine. um, but he created these techniques, visceral neural manipulation, where you do a general listening to the person. So, the way that I was trained, you basically have the person in front of you, the patient, close their eyes and they're standing. And then you, as the provider, you actually place your hand on top of their head. And you listen with your hand because the thenar eminence, hypothenar eminence, I can't remember if it's thenar or hypothenar. I think it's hypothenar eminence. Um, you're actually able to distinguish extremely well um, sensations at that point in your hand, and you can train it to become even more sensitive over time. So you use that part of the hand to feel where the body is actually drawing towards. And at first I'm like, "Oh my goodness, this is some woo-woo woo-woo stuff." But I've taken the course and I've practiced with friends on friends who have taken the course, and we'll do that general listening on each other or on one person, and we won't say anything after we listen. And then we each say, where we felt the body was drawing towards, and it actually lines up and it's super interesting and really cool. So that's the general listening. And then you go to local listening where you put your hand at the abdomen and you feel again where the body is drawing towards. And that's basically a confirmation. It's much more nuanced than that. But once you find the spot that the body is wanting treatment or wanting the hands on work, um, you go to that spot, and there's different directions that that organ is supposed to move, different ways that it's supposed to move, and orientations. So, just like any other joint in your body, like your elbow, your knee, or your hip, there are biomechanical ways that that joint is supposed to operate. And the same thing is true for your organs as well. So you go to that organ and then you check and see how well it's moving in all the directions in the ways it's supposed to move. And then you take the organ into the direction of ease, which creates an induction. An induction is um, it's a reflex essentially that happens in the body where you're taking the organ into the restriction, further into the restriction, and then as a result, it reflexively opens up and is able to move in all the directions it's supposed to be sliding and gliding. So that got way more technical than I intended to go into detail. But that is an example of what visceral manipulation is and what your treatment would look like with that therapist. Um, the LTAP, basically, what that does, um, that is a way of using orthopedic assessments to distinguish where the body wants treatment first. So you're able to delineate if you are actually having um, an orthopedic issue in the lower extremity, or if your body needs something done with the viscera, or if the body needs something done with the nervous system. Um, that training is done through Anna Hartman, the Movement Rev. Highly recommend following her if you are a provider and you're listening to this, or even if you're not and you're a nerd and you want to learn a lot. She's a great person to learn from. She is a wonderful mentor as well. I will have linked in the show notes how to find these particular providers local to you so that you can make your own choice based off of their educational level, making sure that they're trained and certified, because there's some people out there that say that they're craniosacral therapists, and I question if they have actually gotten that training or not, based off of, some of the things that people tell me. They're like, "Oh, yeah, I've gone to see a craniosacral therapist. It was really super weird." And they tell me some interesting things that happened during that session. So you want to make sure that they have actually gotten the sufficient training. But as a recap, these are the 3 tips to get the most out of your hands on therapy, your body work. Bring your wedges with you and set your body up for success. Communicate clear expectations. No one is straightening your spine today. And thirdly, choose gentle nervous system based modalities instead of more aggressive techniques for your hands on treatment. I would love to hear from you guys about what you thought of this episode. You can comment on YouTube, give me a star rating on Apple. I don't ask that very much. I always forget. Like and subscribe, all the things. But I love that you are tuning in and wanting to learn more about your body, your scoliosis, either for yourself or for your loved ones. Until next time, stay well and stay ahead of the curve.